group. This is only, I guess, half of us. There is another 3 or 4, who aren't with us today, but each of these lovely people, we've got Jill McDonald, Belinda Johnson, we've got Debbie, and we've got Carla as well, all going to do sort of a little bit for you to introduce the subject to you. So, obviously we warmly welcome you. We are videoing these sessions, but we're only videoing us doing this bit for our Facebook page, so you guys won't be in it. So if you prefer not to be around us doing it, then please feel free to leave as well. Okay, so this is our second meeting that we've had this year, and in June we were joined by about 30 RVNs who were at least 5 years qualified, and actually some of them quite a bit more than that, weren't they? They were quite experienced veterinary nurses, and certainly they were all interested in the whole concept of district veterinary nursing. And in conversations, a lot of active ones then continued on our Facebook page, which was really good and really encouraging. So to give you a bit of background, district veterinary nursing was formally identified in the 2016 VN Futures Report, which, as most of you will know anyway, was an RCVS and BVNA joint initiative. The idea of trying to provide more nursing support in the community isn't new, and there are a number of VNs with various business models, but as far as we're aware, none to Carla's extent, which you'll hear all about shortly. We want to say a big thank you to BN Times, so I don't know if they're in the room yet. You're here, brilliant, sorry. For publishing Carla's story late last year, because it brought us guys together to form our group, and we're really fortunate to have some very talented and experienced members who want to support Carla as much as we possibly can in achieving her goal. And that is basically trained, registered district veterinary nurses offering a service in their communities across the UK. So we hope this will be a mildly contentious session and maybe a little out of our comfort zones, but we believe this really does need to be pursued for the greater good and needs to be all of our focus. So I will introduce you first of all to Carla, who is our district veterinary nurse, and she's going to tell us actually what is a district veterinary nurse, and then we're just going to go into each presentation in a one-up. So Carla, down to you.
Thank you. I've never done this before. This is very weird, and you're all so clever, and I'm so honored that you're here. So I'm just a girl that had to go for it. It was very scary. Having worked in my community as a registered veterinary nurse for 17 years, and lots of vets and veterinary nurses and clients thinking that I was a little bit bonkers, but hey, let's try it. We went for it. So we have a little video to play for you.
Hello, my name is Carla Finzel. I qualified as a veterinary nurse in 2001, and it appears to be that my district veterinary nursing of the last 3 years is the first of its kind in the UK. So let's talk a little bit about what a district veterinary nurse does. We have human district nurses that treat patients in their home. And district veterinary nurses do the same for animals. Under the direction and instruction of the veterinary surgeon, a district veterinary nurse provides intensive care nursing, specialist clinics, palliative and end-of-life care. We do this in the home for several reasons. Mainly because many pets find it stressful visiting veterinary practices, and is terribly important that they have absolute rest in order to fully recover. We also visit homes to help pet owners that struggle to visit the veterinary practices. This may be due to work commitments, this may be to physical disabilities and mental health. They may be located in remote locations and transport is not regular. Owners love their pets, and we ask too much of them, expecting them to have nursing skills that we as vets and veterinary nurses have taken at least 3 or 5 years to acquire. A district veterinary nurse coaches and mentors pet owners, giving the confidence and empower them to treat their pets in their home.
So this is Mimi. She's my cat of 14 years. I've got 2 cats, one's called Mocha and one's called Mimi, from the same litter. She became gravely ill a couple of months ago and was in hospital for a good 7 days. When she came out, I was just given all this medication. I didn't know what to do. She was stressed, I was stressed, and I just couldn't handle it. And I went to my vets, and she very luckily knew Carla, who then helped me look after her for 2 weeks. It was I couldn't have done it without her. With all this medication, she came twice a day, 8 o'clock in the morning, 8 o'clock in the evening, and she managed to get well because of that, and I don't think she would have done without it. It's just so difficult to pill animals, to give them all this stuff on your own and without any kind of medical training. So thank you, Carla. You can thank Carla because she's still here because of it. I think without Carla, I wouldn't have one of my cats now, without doubt, and 2, I probably wouldn't have my sanity. So I think it's a great service that really, really needs to be looked into because it's helped me as an owner.
Hi, my name's Roz. I'm a veterinary surgeon that works at Busy Hospital in Brighton. We have lots of intensive care patients who we struggle to get home, and we feel they're well enough to get home because they're on multiple medications, sometimes having tube feeding multiple times a day. And people are really busy, and it's a lot to take on when you're not used to that level of care for your own pet at home. But also, apart from helping us with that, the district veterinary nurses such as Carla have been helping with our newly diagnosed diabetic patients. So starting them on their insulin injections, which can be really challenging, and also our hypertensive patients or potentially hypertensive patients that can be checked at home and their blood pressure measurements taken in an environment where they're very calm and comfortable. For me, something which I find particularly useful is when we have clients who are either elderly, disabled, perhaps clients with dementia who really struggle with some of the new treatment regimes we recommend them, but also taking in information when they come to see the vet. So if they have a report that goes to the district veterinary nurse, the district veterinary nurse can go to their house, can assess how they're getting on, show them how to medicate, and just help them with the day-to-day tasks that they've been introduced to by the vet. I think without that, it's really hard to expect them to do what we ask of them, and also it means we've got eyes and ears in the community that can feed back to us on how these new regimes are going.
This year, the District Veterinary Nurse Development Group has been created. A team of volunteer vets, veterinary nurses and human nurses who have come together, moved by the impact of my work since 2015. We as a group want to build on my work together. We know there is an appetite for this. Your support will help us get on the road nationwide to warmly meet these wonderful veterinary nurses and have them start their journey towards becoming that all-important link between the vet, the owner and the pet in our communities. This will be the start, and from there the district veterinary nurse role can grow.
Right, so I mean, I see happy people and happy pets in there. I see that a vet is not as stressed at the challenges that her clients may face when she diagnoses a condition and finds a treatment, but what is going to happen, what's going to be the next stage at home. Home is where he's at, I find. I started a crowdfunding to help the group get materials and resources, and my driving goal is always these two reasons. The advantages for the care receiver and the care provider. The benefit of our clients. I think you do this for 20 years and you either get really hardened up and say, I go into the clinic, I do what I can, and I finish my job that day, and that's that. Or you get more and more soppy. I think that's what's happened to me. I get more and more soppy the older I'm getting, and I'm saying, I want to go home with you and your dog, and you and your cat, and you and your rabbit, because, you know, that's it. I'm 47 and I'm getting menopausal or something like that. And the benefits to the veterinary practices. You know, guys, how many qualified veterinary surgeons are stressed at how involved our profession has become. I've locum recently for 3 weeks at Vets for Pets. They were amazing, and a really lovely newly qualified vet was really overwhelmed, and they're leaving the profession. Distress and or worse things happen to them, and I care about my vets. I'm here to serve my vets and or patients. This is a little bit, I think, how the public sees us at the moment. I think that tells a lot. Going to the vets is this, and there is we are scientifically huge. You know, we can find treatments for everything, but we are not following to the next stage. To me, it should be presenting symptoms in the consult room. The vet says, okay, intervention, I have to do an x-ray or bloods, diagnosis, this is what's happening with your pet, and this is the treatment. The next stage is, would you like the district nurse to come and start off those inhaling sessions at home with the inhaler. This is Jake. I mean, you have to be a very dexterous person if you are holding your cat and you're watching the little valve, watching for the in-breath, keeping the mask on, and reaching over to this little top here with your thumb to press and then hold and count to 15. That's challenging for any of us. We usually grab a vet or an ANA or someone to help us. As far as I'm concerned, I'm looking after 2 sentient beings at all times when I do my nursing clinics. I'm looking after a person that is worried, anxious, is going through a lot. I'm looking after, well, as well as the patient, but I'm looking after the vet that is worked very hard to stabilize that patient and find the right treatment. And I'm looking after Jake. This shouldn't be rushed. This should be done in a very peaceful manner, and I don't want an owner stressed at home feeling impotent and incompetent. I want the owner at home supported, and if I have to go out to the whole house and do it for a few days with them, have a cup of tea, I think we're going to have better outcomes at the end, and we have reached them with Jake. He's doing really well. He doesn't need the inhaler anymore, actually. This is Kiko. Kiko, the week before this assessment that I did at home, had to be sedated for his blood test. And I actually feel for my vets because they're having to prescribe medication on false results. And I think that's very, very risky. I don't think any vet likes to do that. And this is Lucinda, who was referred to me so after her road traffic accident, tail pull injury, so it didn't have to come morning and evening at 8 o'clock and at 6 p.m. to have her bladder expressed, or a weekend she would have had to travel 14 minutes each way to the nearest out of hours. So instead I visited morning and evening. And she's very well now. She actually regained neurological control of her bladder. So we want this to move forward. We want to see the equivalent of human district nurses in our veterinary profession doing all of this, which is what I believe they do, what I've been doing. This is Monty, diabetic cat, presented at the vets by an arthritic wrist, walking stick. She had 2 weeks prior this cataract removed, and this one still needs to be operated on, 86-year-old lady. And Monty's her best friend, is what she calls my heartbeat.
Mm-hmm.
And we had to give insulin injections morning and evening. And she said to the vet, "You're asking me?" And the vet said, "Oh my God, euthanize, we're home, what do we do?" They refer the case to me. On the 30th of November 2016, in a week it was stable, and by 10 weeks it was declared, on the 10th of February 2017 it was declared in remission, and he's still in remission, so he's doing really well. And this was a real challenge for the clinical team because they thought there wouldn't be Monty anymore. This is Ralphie. He went to the groomers. Half an hour later, the owners get a phone call to say, "You've got to come and pick up your dog, take it to the vets." It was burned. That's an ongoing investigation, but that's not what I'm here for. Very, very busy professional household. She's actually a human nurse in a hospice for cancer patients. The husband is a barrister, very busy in London. It was impossible. They could make it twice to the veterinary practice in the day to have the wounds flush and flamacine applied and the painkillers and everything else. This poor little soul, after what he'd been through, the last thing he needed is to be hospitalized all day. So the nurses on duty could do the wound care. Also, the vets didn't want open wounds in a hospital setting where you can have infections. So I went in twice a day for a few weeks, and we're doing really well. I mean, yeah. This is not the final photos. I didn't. They were too busy to send me the last ones last week, the owners. But basically, we are just little patches. So that was a happy ending again. So this can take forever. I've been at it 3 years, and I'm working from 6 o'clock in the morning till 9, 10 o'clock at night. I'm really, really busy. I need help. I want to see 3 to 4 district veterinary nurses per 5-mile radius going out, helping vets and helping their clients. So we need it now. I don't expect we will fulfill everything like today, and we will develop and evolve. And I learned this recently: by the yard is a heart, and by the inch is a cinch. And I love that. That's helped me a lot. This is a spirit. A spirit was found in the next door's neighbor's garden. It was like this. It came into the hospital, and it was onset blindness and paralysis. They did what they could in Brighton, and they decided that the best thing was going to be to take it up to Anna Tauro at Fitzpatrick Referral, the neurologist. However, this animal had to be transported somehow up there with a crash kit and oxygen in an oxygen tent. The vets called in, they said, "We have a really nice case for you, Carla." And I said, "Yeah, what's that?" And they said, it's obviously consented that if he dies in the owner's car, you know, that's it, but it's the only chance he's gonna have. Would you be able to join the owner's seat at the back with the oxygen tank and take it to Fitzpatrick referrals? And I said, I love you so much, thank you. We made it there, and Atara did a CT scan, and it was a lesion C2, C3 that obviously all the pressure intracranial created the blindness. It wasn't insured, and it was gonna need a lot of intense nursing if it was to make it. We put a feeding tube, and he came home. I don't have a video, but anyone that wants to see a video can email it at some point of how a spirit was. A spirit regained his vision once this bruising in the brain was sorted, and then he was left like this, and like this. And he wanted to leave. He really, that name, it was so meant to be for him. He really wanted to leave. I visited 8 times a day, at all hours, through Christmas, through New Year's, 2016 to 2017, the same as I was doing with the diabetic Monty for the elderly lady. 4 months, and he's walking, and he's jumping up trees, and he made it, and it is just amazing. I'm very, very blessed. This is CJ Megasophagus. Elise Robertson, the feline vet, plays that, and I coach the owners how to feed it at home. 3-4 years on, he is just a happy cat. They have a very special garden that they've obviously done like a enclosure type of thing, so he can get out, but his trees within the garden, and he climbs up, and everything is quite amazing. Sarah, just a girl like me in her 40s, going about her life, and then you have a stroke, and then you have to rebuild your life again. So what are we going to do? Are we going to take your best friend away from you, or are we going to do everything we possibly can that if anything ever happens to Molly, she's supported? Lo and behold, Molly got cancer. So 18 months ago, lymphoma, breaths, morning and evening, and every 72 hours chlorambucil. Sarah can't use a knife and fork very well, let alone even if Molly, who's very sweet, comes and sits in her lap, can peel her own cat. So, but here we are. And she's become someone I will protect through thick and thin, and anybody that is in that predicament. And Tigger, a very sweet guy, he was diabetic. What's happening here? Not stabilizing. What you doing, Carla? You're not doing your job well. It's not stable in a week. What's going on with you? And I said, I think it's something more. So he went up to Potter's Bar, and this lovely man we all know, and I forget, Steen? Yeah. Yes. He sorted him out, and then goodie bag. You come home with that, but you have an animal that is shaved completely, and the owners have to do an eye drop, a tablet orally, Leventa orally, medicaments and food, but he's not really eating, so it's all very stressful. I was put in place before the operation took place, so when the owners came back, I was there at the house when they came back with Tigger. And that was really good, because that meant that all the care that he was having in the clinic, in the Potter's Bar, straight away, it continued. It was no falling back on that amazing work that had been done at Potter's Bar. Henry, angioinvasive pulmonary carcinoma. At the referral center, and the consultant that diagnosed it had never seen one, only by textbook, and she thought this was so bad, it had to be put to sleep straight away. The owner, a 38-year-old man, and his wife, going through cancer treatment himself, I can't deal, I need Henry home. And the message I got from that consultant and from a hospice and palliative care vet has had enough vet handling. He's very screwed on, so you just won't be able to sneak anything into him, I'm afraid. The owners have been taught about towel wrap for his nets, but this is very, very stressful. Be aware. And I visited him 3 times a day for a further 5 days. He had no pain. I came in, did what I had to do, so he had very good pain relief, and they had 5 days at home of palliative care and support, and I said that Henry had to go in between his chemotherapy treatment, and that helped the owners so much to be able to do that. Thank you for listening.
So that's our Carla, and I think you can all agree, you can absolutely see why us as a group want to support Carla and try to bring this out to as many people as we possibly can. So we'll get down to a little bit of business now next with Debbie Gray, and she is basically going to talk about how we see the actual district veterinary nurse developing. Thanks, Debbie.
And I just start by saying that I think it's very hard to follow Carla, and I find her passion, and she's so inspirational that it just makes me get a bit emotional listening to her and hearing those stories. So well done to Carla. I've been given 10 minutes to talk about this, which is nowhere near long enough, because I spent an hour just talking about it last time and we decided that wasn't long enough. This is very much in the infancy stage, so I'm going to kind of rattle through this because I'm aware there's other presentations, and then have some questions at the end. So just to repeat and recap on what Carla said, our vision as a development group is to basically have an availability of trained registered district veterinary nurses throughout the UK so that they can support people in the community and do this amazing work that Carla's doing. So as a group, we have recognised that there is a requirement for a post-registration training programme. Ideally, this would sit within the RCVS BN Futures postgrad framework. It's something that Dot's already picked up on, that it was identified in BN Futures. But we need to be looking at things on fundamentals of district veterinary nursing, advancing patient care and client care, care in the community. It's not something that registered nurses are necessarily going to be in a position they can just go out and do. So we have recognised that as a group, and there's an element of business planning they'll need to do, and working solely independently, have to make sure they're safe and think about the environment they're working in. So what are the skills and knowledge requirements? Again, this is just kind of skipping over this very briefly, but need to be able to interpret the code of conduct effectively, and they need to know the limitations of their role, and that has to be absolute paramount. The nurses, they obviously should know that as a registered veterinary nurse, but I think it's something that we need to be reinforced, looking at some of the legislation, looking at the code of conduct, and make sure that's be aware of. I know Jill's going to pick up a bit more on that in a minute. Just listening to some of the situations that Carla talks about, and Belinda's going to be talking more about that. I think as a person, you're going to need to be a fairly confident person. You're going to have to be very resilient and emotionally quite strong as well. So we have to build on those transferable skills that everybody has, but there's probably an element of work to develop and evolve those skills. Understanding responsibilities and links with One Health and One Welfare. For all of us, I think on this development group, this fits very nicely with the One Health initiative, the One Welfare. It's such a big thing that's been talked about now, and linking up that care in the community for people that Carla just talked about. I think it's just paramount. It fits so much into that. As a district veterinary nurse, they're going to have to be a critical thinker. They're going to have to be able to evaluate, self-reflect. They're going to have that growth mindset, and know their own abilities and capabilities, and be able to determine where they need to go off and develop themselves personally as well. And it might be picking up areas, if diabetes is not their strong point, then going to need to go and do some more CPD in that area, and be very aware of their limitations again, and just some business and leadership skills really. So just to try and kind of put this into some kind of conceptual framework, I don't know the best way to kind of try and encompass everything that we're trying to achieve really. But if we start in the middle with the triangle, they're going to have to be a self-reflected learner, you know, which we hope all registered veterinary nurses are, but we have to be able to reflect, and that has to be an active learning process that is evidence-based and ongoing, and you know, rely on that evidence-based source. Which ties into the leadership skills, because we're going to be collaborating with veterinary surgeons, which links in with the business skills. You need to have that strong communication based on veterinary referral. Reports are going to need to be written to the client, to the practice, and to anybody else that's in that disciplinary team. So that, you know, is something that would again need to be involved. There's going to be an element of coaching, educating owners, talking to the public about different things. So again, you know, coaching skills, if they haven't already got those, are going to need to be evolved. And this, as a district veterinary nurse, they're going to have to be able to reflect and take initiative, and sometimes make decisions, and if they can't make those decisions, know who the right people are to make those decisions. So it's about encompassing all of that really into one training programme, if we possibly can, is our scope. So as a group, this is very much, you know, in its infancy. We only kind of all came together in spring of this year. We've kind of said, you know, you must obviously be a registered veterinary nurse, and ideally you'd have a minimum of 2 years post-registration experience before we look to embark on that district veterinary nursing journey. I put a question mark, I don't know, that's probably something that will come up for discussion at the end. We kind of feel as a group that it's essential that you probably develop some of your basic nursing skills beyond the day one competencies before we look to evolve into going out into the community and doing some of these more advanced nursing skills, which hopefully you would have picked up from a couple of years in a practice environment. So we have had a look at the human district veterinary nursing. We've obviously got Kathy on the group, who is a human district nurse as well, and she's input into the group. Their training programmes do lead to specialist practitioner qualifications that must meet the nursing and midwifery standards of their council. They sit at degree, postgrad and master's level, normally no less than 1 academic year, and it is split between a 50% theory and 50% practical, and they concentrate on 4 key areas, which are clinical nursing, care and programme management, and development of clinical practice and leadership skills. So very much tied in with what we thought as a group, where we needed to start and drive. So we were it was reassuring to kind of get Kathy on board and find out that they do a similar approach. But the other thing that we're very aware of as a group is that why we're saying, yes, we'd like it to sit within the RCVS VN Futures framework at postgrad, master's level. There is financial considerations, and there has to be a balance, and I think it's something that as a nursing profession we need to look at for veterinary nurses, because it has to be affordable, be able to accomplish our vision and our goal of nurses going out to do this role. It has to be a level that is accessible and affordable to everybody really, and again that's probably how we're going to maintain them, and there'll have to be some sort of list or register, you know, like the RCVS, whether it would be under the RCVS. Again, it's very much in its infancy, everything's up for discussion, and you know, work on a similar process to what we work on now as RVNs in terms of maintaining knowledge, maintaining skill set, and evidencing that professional performance, and the impacts that it will have on the patient and client health. And I think hopefully some of those case studies that Carla's already discussed, the outcomes for the patient and for the welfare side of it, to me it just seems, you know, why are we not doing this? It's something that we need now. So that's kind of where we are as a group. So really just to summarise in a quick 10-minute session that I had, was that our future vision is, yes, it would be lovely to have something very similar to the human district veterinary nursing, human district nurses under the Nursing and Midwifery Council. We'd like to have some sort of specialist qualification, which is obviously something that's being discussed under the Veterinary Nursing Futures project. timeline and financial considerations may hinder the development of that for many years. I don't know, again, that's up for discussion. There's lots of people that are involved in education. Perhaps that is something that can happen quicker. But we'll look to implement an introduction course at this stage. But we'll, of course, welcome thoughts and feedback. That's why we're here today. As I said, we're very much in the infancy, and we'd like everyone's thoughts and input at the end of the session. So, thank you very much.
Did you decide to choose that picture? Thanks for that.
No, it's not me.
And if I could introduce Veterinary Surgeon Belinda Johnson next to do our next part, and she's going to discuss supporting the human-animal bond.
Can you see okay? Can you see okay?
Right, I've now got 20 minutes, which is going to be a real test for me, because if any of you have heard me speak before, I'm always overrunning, so bear with me. Supporting the human-animal bond. What we've got here is an introduction to the charity that I run in Suffolk. It's a collaborative approach. I cannot not speak about it, but I've also got to limit it because this is all about the DVN role. The case studies I'm going to show you, I want to really stress the fact that we're talking about here about patients that the vets already know about. We are finding a huge number of animals that are maybe known to a vet, but not being seen, or aren't known to the vets at all. So bear with me as we go romp through the whole field of human-animal bond. I know you all know about the human-animal bond, but what I've got this slide up for is because there is a very strong definition behind it. This is so well evidenced, the field, the health and social benefits of the human companion-animal relationship. We aren't starting anything new here. There is a wealth of peer-reviewed, well-evidenced research. What we're doing is putting that into practice. What I'm seeing is there are fantastic health and social benefits for all animal welfare and human welfare, but only if the relationship is appropriate, a lot of them aren't, and if it's well supported, so many aren't. So we have a mutually dynamic, really wonderful resource of where animals can help people to cope, but it's not going to work if they're not on the veterinary radar and they're not appropriate or well supported. This is what we call our Wheel of Collaboration. It's a very ambitious project I set up 4 years ago, a registered charity, to integrate at a local level health and social care. You know, considering people have been trying to do it for decades, why don't we just try in a tiny little place in West Suffolk? But it's working, and people get really frightened of doing things new. But someone turned around to me at the beginning and they said, oh, for Christ's sake, just do this. So I just did it. I started about 8 years ago. And what we do is that, what we've got here, oh sorry, I'll find a pointer on this, hang on. So here, we've got human health and social care. Here, we've got animal-related things, and each time I do any kind of case, I just want to ram another thing up there. And what we've got here is the veterinary profession, which is very siloed. But we've got community outreach development happening with wonderful initiatives like the Street Vet, looking at homelessness. We've had the Links group for years, pioneering the support for domestic abuse. Community outreach with mobile veterinarians, hospice and palliative care. It's all coming together. And bond-centred veterinary practice. A lot of people don't know it being called that, but there is this emerging, very exciting new way of working. OSF, our Special Friends, is a collaborative approach, and we can get very close to people that other people can't get to. We have a lot of resources in our society, but they can't reach these people. If someone has a love of animals, it's incredible. You've got a magic wand. All I have to do, and I spent hours trying to find out, particularly if it's a hairy dog or whatever, it's difficult to see the sex. But if you turn around and say, how long have you had her? Off they go. You can talk to anyone. If they have an animal and you can get the sex of the animal, how long have you had her? It's an easy, very easy conversation starter. Vets have always had very good therapeutic relationships with patients, also with the clients. They have very good safe relationships. People are free to disclose, and anyone in veterinary practice will have had the most incredible stories told to them. And it's because they deem us to be very safe. And if you use that magic wand out in the community, it is unbelievable what people disclose. I walked into the centre and I didn't know where the registration desk was, so I went into the general information, and I was just there and we were chatting. I gave them one of my leaflets after we talked about the Wi-Fi code. I can't tell you what was disclosed to me when I told them what I was doing. You know, it's amazing. You can get, this approach can get very close. So OSF, our special friends, is here alongside friends and family, if there are friends and family. The friends and family may be just the animal, the other heartbeat in the house. The neighbourhood network is all here, masses and masses of really effective resources. But if you're vulnerable and you're having a really tough time, how on earth are you going to access that? I spend a lot of time telling people 0800 470 80 90. Silverline, 24/7 befriending that Esther Ranson raised 4 million for, and it's out there. But how does someone who needs to talk to someone who's not online, who's feeling socially isolated, how do they hear about the Silverline? And there's lots of GPs and people out there, specialist services, and vets are there, and rehoming centres are specialist services. How does somebody who's bereft of a husband, he was the driver, feeling a little bit insecure, not online, how do they find that new companion animal? They don't want a puppy, they want a new mature companion animal. This fits incredibly well with what the health sector are wanting to do. I'm not going to go through this slide. We've got a website, we've got a Facebook page. I could talk forever on what we're doing. But I put a fishing net out there to find out what the cases are. There are masses of cases where practical and emotional, not rocket science, support with volunteers. We have 70 volunteers at the moment who help us. What you need is you need a good practitioner approach. District veterinary nurses will be amazing at being part of this kind of team, because of the analytical skills, because of the compassion, because of the communication. You can do all these things, but I'm not going to go through it because of the time. What are the human factors? We all know people who are lonely, and the recent research is you don't have to be old to be socially isolated. There are masses and masses of mental health issues, masses of people. There will be people in this room who are feeling incredibly lonely. We're talking about invisible vulnerability, hidden disability. It is everywhere. There are lots of issues that are out there, and someone asked me today, is it getting worse? I don't know. All I know is that everybody I talk to has a backstory. And the amazing thing about it is that they are happy to share it with people who are deemed to care. Animal welfare issues, what are we seeing? We're seeing animals that are not registered with a vet. The number of times they're not registered, they're not vaccinated, they're not neutered, not that they need to be neutered necessarily, or they've been to a vet and they're no longer going because the owner is under hospice care and they're not concentrating on the animal's needs. So, or they've been prescribed, they're not being given the prescribed medication. I've got a slide to show you that there was someone who was being given pills to give to her dog. She was registered disabled. For years, she just didn't have the heart to say to her vet that she couldn't physically give the pills. We're also seeing animals with untreated conditions, and that's because someone living with dementia with an animal doesn't notice necessarily that the ears are inflamed, doesn't notice, there are so many conditions that happen because of people's vulnerability. Vets see a lot of people who are vulnerable, but it's not their remit. Human health and social care see animals in the equation, but they're deemed to be a nuisance sometimes. And the thing is, it's understandably not for them to care about to do anything about the animal welfare. District veterinary nurses will be able to be really fundamental in helping these animals that haven't chosen to be mental health carers. A lot of animals are out there supporting people with huge vulnerability, and they haven't chosen to be there, and so we do need to make sure that their welfare needs are being met. And obesity. I can't tell you how many cases I see with animals that are obese. Owner vulnerability has a major impact on our patients. So I want there to be a sixth welfare need. I'm becoming more and more of a campaigner, an activist. I'm amazed I'm still married. Particularly as this charity is still run out of a domestic setting. The next stage we've got, and it's a huge hurdle, is to have a community outreach, a hub, where people can come. Why are we called our special friends? What does that mean? It doesn't mean anything really, but it's because it works really well for people who are feeling, lonely, unhappy. They can approach us. You can't easily approach the RSPCA. We work very closely with the RSPCA. They've been amazing in some of our cases. Why isn't it called Our Animal Friends? Somebody said that to me. I said, well, oaf is not really a... So it's Our Special Friends, and it fits amazingly well with this one welfare concept. So we need multidisciplinary support. So I'm going to show a picture. This is a gentleman here. We got him this dog. And it was it was actually a classic, difficult little terrier, but he loved and adored it. If I show you the next slide, this is them 4 years on. We really, really, really tried hard to manage the weight. A district veterinary nurse with this patient could have helped us. We had dog walking support. We had advice about the fact, yes, his previous dog was a German Shepherd, but this isn't a German Shepherd. We even gave him a smaller bowl. But his wife had died. He was used to having company when he was eating. So what he did is he just fed the dog instead. A district veterinary nurse could have done an amazing weight management program in that case. This is the lady here who actually was referred to us by Age UK because there was dog feces on her Zimmer frame. There was a lot of practical emotional support and advocacy to keep them together, but she was the lady with the tablets. We just turned around to her vets and said, well, she can't give them. They did injections instead. Again, not rocket science. Patsy here, 82-year-old Parkinson's lady, turned around and said, well, my husband died 2 years ago, dog has just died, I need to fill the void. Enter Patsy. Just by chance, what we added over the 4 or 5 years was different volunteer support as and when was needed. Happily, one of the volunteers had veterinary skills and noticed the increased urinary frequency, which led to a bladder stone diagnosis. She also, at a later stage, noticed breathlessness, early diagnosis and early medical intervention of heart failure. And we do practical, we do emotional support, the whole package, if you're out in the community, is really good. With this case, what made me smile was when the vet turned around to this lady, who was 84 at this time, with Parkinson's, and asked for a urine sample. I defy any of us to find it easy to get a urine sample from a low-slung, hairy Cavalier King Charles bitch. So we stepped in and helped sort that out. So what confuses people about the work that we're doing is that we also have a visiting dog program. And that's because when people can no longer have an animal, we didn't feel there's evidence that actually seeing an animal once a week for an hour has therapeutic benefits, animal-assisted activity. So this was a case where I went to go and assess the need for AAA. The person had been signposted from a support agency or support worker. And these were the pets in the environment. Admittedly, the grown-up person, her parents had died. She had significant health and mental issues. This is the cat that was emaciated, possibly hypothyroid, renal, very matted, and I was sort of going, I think that needs to have some veterinary care. This was one of the rabbits, absolutely no hay at all. Ocular lesions, oral tumour, definitely in need of some support. There were neighbours who were helping, but they didn't have authority. And despite the fact that I did what I could to get the animals there, we cannot be directive. We cannot say, you must do this. But we empower people on the journey. But these are animals that are registered with a vet, but they're not actually receiving veterinary care because of human vulnerability. We're coming across some incredible cases, and this is one where a lady, young lady was fleeing domestic abuse and went into mental health supported housing for 3 years, and she got Oleg. She went then, unfortunately, for the next 5 months, wasn't able to look after her cat, so we picked up Oleg with the mental health support worker, and I took him immediately to the vet to get a first vaccination, because you don't know when you're fostering to reunite where that journey might lead you, and not have, he was an indoor-only cat for 3 years, no vaccinations, had been castrated. I placed him in a foster home, and I was told that he had escaped. I can't tell you what panic that caused on a Friday afternoon. Anyway, it turned out that Oleg had gone behind the plinth, behind the washing machine. So he was found. But there was no way that we were going to take him out of that environment for his second injection. So we did it in situ. He was absolutely terrified, having been an indoor-only cat for 3 years with one person with mental frailty. So it was the kindest thing to do. This is a lady, it was a video, but I've cut out the video. But you're looking at her here, and she has the most wonderful way of saying how important her animals are to you. And I put this up because she's very rational and very clear in the way she describes it. If you spoke to her on the telephone, you would think that everything was absolutely fine. If you saw her like this, you would think everything was absolutely fine. We were the only people that got into her house, except for social care. And the reason for that is that this is the same time. This is the same photograph day. So we were called in, the parish council were really worried about this woman, known in the village for years. They were worried, and they spoke to their county councillor, who knew us, who got us in touch. We established a huge rapport with her. She could get to the clinic. Her animals were being looked after. This dog had been looked after by Dick Whites. But what happened is that when she got very vulnerable, she had a hip fracture, she was on crutches, she couldn't get to the vets anymore. So we got the vets in. And the vets, although the regular vets had been looking after these animals for years, they'd never been to her home. We're really proud of this case. This came through social care. This is a gentleman with Billy. Billy was scratching for Britain, absolutely scratching. Never been on any veterinary radar at all. Rang the local vets. Could you possibly help us with Billy? Would you like to bring him in? It would be lovely if you could come out and see him, please. Luckily, the vet I was talking to I'd qualified with, which was helpful. And he very sweetly came out and didn't charge us, which was helpful. I don't expect vets to do that. Everyone's running businesses, and we get funding from people. We need masses more. But the whole idea about this is that people who are interested in social isolation, mental health support, community cohesion, social prescribing, can give funding to support these meaningful relationships. Well, we looked after Billy. Billy was just blossoming. One of the things we did, which was so simple, is that we made the garden dog-proof. Billy was not being allowed out in the garden at all. And when we opened that door and he got out and went around, he peed on it was a nice bit of grass. It was fantastic. We were all ecstatically happy. It's a very, very rewarding side. This is what will be exciting for people coming into this field. It is incredibly rewarding. Well, they have an emergency. Poor John had an emergency admission. Billy went into foster care. He was washed 7 times before his coat went clean. Billy got major health check because he was fostered and he kept on peeing everywhere, because that's what happens when people are vulnerable. Animals don't get let out. Their house training can go haywire. So Billy got a fantastic health check, and this is them reunited in their cleaner home. And John had health and haircut and everything, but so had Billy. And you can make an incredible difference. This belongs to a lady with learning disabilities. She has carers going in daily. She's a very sweet woman, and she has very good vet care. But people aren't looking at the whole animal. And it just so happened that I went in to check that everything was all right, looked at the dog's eyes, got a bit of saline, cleaned them up. And I think we are completely underestimating our skill sets. I'm really blown away by the impact that I can have simply because I have got that kind of veterinary knowledge. I'm not using much of it at all, but also the ability to look at a complex situation and say, what's the local support here? What is essentially the issue? What is the problem? This was another case. I've got the slide in here. I'm not going to go through it. What it is people end up in emergency housing. They have to relinquish their animals. This was a case where someone, unfortunately, was under the influence of drugs, lost his children, lost his housing, lost his dogs, but in as much as that he had to hand them over to us. So he handed them over to me in the dead of, well, it wasn't dead of night, it was sort of in the dark, in a street in Bury St Edmunds. And luckily he told me that one of the dogs had been scratched by a cat. So I, in the street, realised that this was maybe something that needed to be checked before I put it into a foster home. And we are having to do that. Take animals out of vulnerable situations. They need to be vet checked. And ideally, with the District Veterinary Nursing role, they can be vet checked in situ. So I took them to the vets. There was a corneal laceration, which was lucky. That was good to catch. While I was waiting in the waiting room, I had my scanner, because I always have the scanner. Scanned them, no microchip. Could we have some microchips too, because it's after the legal requirement? And then I looked at the teeth of the other one. And while we're at it, could we book a major dental as well? So OSF paid for that. But the veterinary intervention, the veterinary knowledge, that dog and those dogs could go somewhere. What happened is that they were then 4.5 months rehomed to him. And he is drug clean after, at the age of 40, having been on drugs for 30 years. That's major stuff. This is a community matron hospice referral. I've hit my time, but I'm going to carry on for a moment. This case, we've got evidence, a casket of a strong human-animal bond relationship here. I got out of here as quickly as I could because there's cigarettes and there was a lady on oxygen, so I thought I wasn't going to hang around. But we were called in because the partner had died, the husband had died. And what I want to show you here is there are pills, sugar-coated pills, not good for dogs, crackers and everything, and we've got some dentist sticks down here. That was the number of dentist sticks. Okay, that's quite a lot. And this lovely dog was showing stranger aggression at the door. The carers were managing to get in. Once they got in, it was okay. So we were asked, could we rehome this dog? And with the best will in the world, you cannot rehome a staffy that has got any aggression. But, so we did have to euthanize her. And it was such a shame. Had we been in there earlier, it would have been fine. She'd had her claws clipped because a vet had come in and clipped her claws, which is really good because she was registered with a vet under good veterinary care. The fact that she was overweight was unfortunate. This dog was not being walked at all. That's why her claws were long. Okay. But this is the really fun bit. She was on a beastie diet, which is good, but not good when the dog is not being walked. Not good when it's being fed dentist sticks until it's absolutely, So there is a disconnect, and the more veterinary knowledge we have out there, the more we can pick up on these cases. The benefits is that we can access vulnerable people and link them to already existing resources in the community. I'm really excited about that because we're in the age of, we've got such societal problems, but what's exciting is how important these relationships are becoming. And the District Veterinary Nursing role is going to be a very, very positive contribution, not just to the animals that the veterinary profession already know, but all these animals that we are finding. We are only in West Suffolk at the moment because the vulnerability is unbelievable. And the volunteers that are coming forward are also in their own way vulnerable. And because we all are, basically, well, some of us are. So the one health, one welfare. But that is not the major exciting bit. We, as a profession, are helping the NHS to save money. 2.45 billion a year. If the veterinary profession comes out of the silo into the community and is supporting these very meaningful relationships and is upping the welfare of everyone involved because of our collaborative approach, we are making an enormous difference. And we can't afford to overlook that now. We really can't. Thank you for listening.
Belinda, that's lovely. So we just have one last short presentation that Jill McDonald's going to give us entitled Professional Considerations for Now and in the Future, and then the rest of our time we'll use as hopefully a little bit of a discussion from over there. Lovely. Are you right over there, Jill?
Yeah, I've just got to open it. Yeah. Okay, everybody. Well, we've heard some really inspiring stuff this afternoon, and then I really drawn the short straw because I've got the last slot of the day, and I'm going to talk about professionalism and legislation. Sorry. So I'm going to talk about professional considerations in relation to the district veterinary nursing role, and I've sort of got a bit of a caveat there because the things I'm going to bring up here it's not an exhaustive list. There's going to be things that I haven't covered here, and that's why you're all here, because we want your opinion and your thoughts too. So yeah, my presentation, my very short 10-minute presentation, is going to kind of have more questions than it has answers. So I'm first of all going to kind of address the rather big elephant in the room, which is when we're talking about district veterinary nurses working on a self-employed basis. Currently, the legislation, which is the Schedule 3 Amendment to the Veterinary Surgeons Act, does offer us a bit of an obstacle in that it states that whilst veterinary nurses must work under veterinary surgeons' direction, they must also be under the employment of that veterinary surgeon. So that does give us a bit of an issue in terms of self-employed veterinary nursing practice, which is the model that we're kind of talking about here. Is there a simple solution to this? And I've put that in inverted commas because there is a simple solution, but it's not necessarily as simple as it seems. We have spoken with the RCVS legal team, and the advice was that self-employed nurses could set up 0 hours contracts with the veterinary surgeons that they're providing services for. And then that gets around this issue of them not being employed by that veterinary surgeon. I guess the obstacle to that is that there are going to be veterinary surgeons and practices that are not necessarily keen to enter the world of 0 hour contracts. It's quite contentious. What are the employment legislation issues with that? So it is a simple solution, but it's not necessarily as simple as it first seems. There are, of course, other situations where veterinary nurses work not in the employment of a veterinary surgeon, such as locum veterinary nurses who are working on a self-employed basis. There is a question about whether locum veterinary nurses should work on a self-employed basis in terms of the HMRC rules that govern that, but that's another story. What about nurses that are practice owners and are working as registered veterinary nurses in that practice, so they're effectively their own boss? So how does that work? It's worth noting as well that nurses that are performing mobile veterinary nursing services out in the community, so maybe more sort of basic tasks like maybe nail clipping or performing health checks, if they're doing that under the banner of being a registered veterinary nurse, they need to do so with a great deal of caution, because actually the advice is that veterinary nurses cannot perform veterinary nursing work without being under the employment of a veterinary surgeon. So I'm sorry to have to bring that sort of serious topic up there, but it's there. So in terms of potential frameworks, if veterinary nurses carried out district veterinary nursing in practice employment, that would kind of ameliorate quite a lot of those issues straight away. But there are pros and cons to that, and there are certainly a lot of pros in terms of veterinary nurses working on a self-employed basis. Hopefully that's something we can talk about in our discussion at the end. So in terms of the legislation, I've just said there we need a review of the Veterinary Surgeons Act. It's kind of a no-brainer. Let's not even talk about it here, because we all know it needs to happen, and hopefully it will happen, and the cogs are turning somewhere, I'm sure. Do we need development of a Veterinary Nurses Act? Because currently Schedule 3 defines veterinary surgery. There's nothing in the legislation really which talks about veterinary nursing. There is nowhere where we can go and say what veterinary nursing is and what veterinary nursing isn't. And should we have that? I mean, surely we should. In terms of human nursing, they have what's called secondary legislation, and this is maybe something that we could think about with the way that we work the legislation for veterinary nursing. So the secondary legislation sits under the main legislation for the medical profession, and maybe that's a way that we'll work it. Somebody as well said to me this morning at breakfast about the Veterinary Services Act rather than the Veterinary Surgeons or Veterinary Nurses Act, and I like that idea. So should we have a distinct code of professional conduct or regulation or register for district nurses? That's a question that we would ask you, but my sort of thinking is that the code of professional conduct for veterinary nurses very much would encompass what district veterinary nurses do, but I think that district nurses will also encounter situations that might require them to have some extra, guidance as well. So I'd imagine that there maybe be an area for district nurses which would incorporate some extra details. In terms of accountability, there's kind of no change for that, for what we do and what we don't do. So I'm not sure there's any change with that. In terms of delegation by veterinary surgeons, it's quite an interesting point, because obviously when veterinary surgeons delegate work to veterinary nurses, they have to be confident that that nurse has the skills, the experience to perform that task. That is, the onus is on them to ensure that. So if they are passing work to a district veterinary nurse, they need to be confident that that nurse has that skill set and that experience and that knowledge to perform that task. So it's, we'd have to build up some way of making sure that vets could be confident that that was the case. And in terms of complaints as well, complaints from clients about district veterinary nurses of the service they've received, it's a little bit more complex, because that nurse, if they're working self-employed, they're not working for a practice, so who is culpable for any issues? And of course, we have to ensure that the public are informed and protected. And if we're talking about public awareness about district veterinary nursing, if that becomes a reality, or when that becomes a reality, the public don't know what veterinary nurses are, so we need to work on that as well. But we're going to have to be sure that the public are aware of what a district nurse is and what they're not. There are a couple of further considerations that Debbie's kind of talked about as well. So professional and emotional support is going to be really important for these nurses. Safety issues as well. They're going into people's homes. Should there be a system of home checking to ensure that, a risk assessment on homes before nurses go into those environments? Are they going to need to have business skills? Well, yes, they are, to ensure that their business is sustainable. Insurance could be a bit of an issue as well in terms of liability insurance. Just looking at VM Futures, a lot of areas of the VM Futures work and their ambitions kind of has an alignment with district veterinary nursing and that kind of role of nursing. But Ambition 5, where they're talking about maximising nurses' potential, specifically mentions the district veterinary nursing role, and that's really encouraging. In terms of opportunities for nurses on a professional level, I think that a lot of nurses are really, really looking for this fulfilling, consulting, caring nursing role, and they're not and they're not getting that in practice, they're not able to achieve that in practice. I think it offers a really distinct career option for nurses, and I think that's really important if we're going to get more nurses in the profession and we're going to keep them there. And flexibility and life balance, I kind of cringed, Carla, when you said that you worked from 6 in the morning till 10 o'clock at night, but that's because we need more Carlas. Hopefully this kind of role would develop a bit more flexibility and life balance for nurses performing the role. And obviously there's a massive nod towards One Health and One Welfare, as has already been mentioned. There's also this potential for advanced practitioners, and how could that tie in with district veterinary nursing, and alongside the potential for prescriber status as well, which I know was recently in veterinary press. And a few of my references, and that's it from me.
Right, thank you, team. So it seems we're proposing something that's a little bit back to front, really. Certainly for veterinary nursing, it was the nurses that came first. It was Jean, wasn't it, back then? It was the training that came after. It was the regulation that then came after that. But what we want to do is it the other way around. So protecting the integrity of this role is really important to us, so we can protect the patient, the owner, and work within legislation framework basically, and also provide the highest level of care as well. And our group believes it has to evolve in this way, looking obviously at both small animal but also the potential for equine as well, which is really important. And I know we haven't thought of everything, and by no means, we certainly know we've got an awful lot of work ahead of us, not to mention funding as well, because this won't be cheap, but we kind of want to open up to you guys, and we've got a few minutes yet, so we'd love to hear what you think. And you can just throw out comments or statements or anything.